Welcome back to another episode of Run Yogi Diaries. This is your host, Santosh Shiva. If you're new to the channel, please do remember to subscribe. If you like this conversation, hit like and leave your comments below and let us know what you think. Excited to have today in the house Dr. Neeta Gautam, a family physician and a faculty in the Stanford School of Medicine. But most importantly, she's someone who's been on this journey of exploring Ayurveda and integrative medicine. She's also a runner. So it's a fascinating combination of expertise and experiences. And I love this conversation, learned a lot about how to balance the benefits of modern medicine and the benefits of ancient medicine like Ayurveda into our daily life, and also use it for our well-being as endurance athletes. I hope you enjoy this conversation. Let's dig in. Also, as a form of disclaimer, all information shared in this podcast is from personal experience and does not construe medical advice. So if you are dealing with medical conditions, you should talk to your physician. Hey, Neeta, or should I call you Dr. Neeta Gautam? Welcome to Run Yogi Diaries.
Thank you for having me. Please call me Neeta.
Okay, all right. I just wanted to make sure I established that you're also a doctor so that people know that you're a medical practitioner. And so, first of all, again, thanks again for joining the show. Let me take a stab at introducing who you are, and then we'll go from there.
Sounds great.
All right. So, Neeta, you're, as we said, you're a medical practitioner and a faculty in the Stanford University. So that's pretty cool. And what got me intrigued about you is that you have been also exploring the intersection of modern medicine with Ayurveda, or should I say, you have embraced Ayurveda. So it also, in a way, intersects with what you do. And you're also a runner and married, kids, and live in the San Francisco Bay Area, right? Anything I missed?
No, those are the highlights of it. Yeah, so just happy to be here, honored that you asked, and looking forward to our conversation.
Yeah, and you have a nice, interesting Instagram handle, Desi Running Doc.
Yeah, sort of captures, some of the highlights of who I am. It's hard to get it all into a Instagram handle, but that was my attempt.
Yeah, it says it all in that one word. Amazing. All right. Hey, so what we can do, Neeta, is first off spend a little bit of time in terms of your own personal running journey. You're a runner, and you describe to me as someone who runs for fitness, and you go easy on your running. You don't try to push and go too hard and too long, but you keep running consistently. So running has been a part of your life. You've been doing half marathons mostly. Um, so let's get into that. How did you first of all get into running? How did that enter your life?
So when I look back, I see the ebbs and flows of activity, right? As kids, we're generally pretty active, and summers outdoors and running around all the time. And then, as I got further along in education and studies, there was that period of, it's all on the academics and not really being very active. And then coming back to it after that period of time and getting back into first walking and then running and then, experimenting with signing up for races and just really enjoying that atmosphere. And then also observing, though, beyond, the running for the sake of running, the impacts it was having in other areas of my life, feeling happier, feeling accomplished, feeling, like I was sleeping better, more active and more present in other areas of my life, so that while the running was important just in and of itself, it was also having these positive impacts in the rest of my life and wanting to be able to continue that. So my goal is to be consistent, and, speed or other accolades are nice. But for me, the most important thing is that consistency of effort, because I see how it's all interconnected and how it helps me in other areas of my life as well.
Yeah. Well said. And how many years have you been running?
Oh, I don't know. Probably off and on for 20 years.
Wow.
Yeah. But, there were periods of time where running wasn't happening, or periods of
Yeah.
time where I was more walking than running. So, you know, but all told, maybe about 20 years.
Yeah, that's amazing. So that says a lot about consistencies there, and you make a valid point, right? Uh, there are different ways to run, right? In the sense that you can pursue running as a hobby, or running as a means to wellness, in different ways. One way to do it is the way you're doing it, which is keep it easy, keep it consistent, enjoy the process. It doesn't have to be all about PRs and the medals, and sometimes it can become an obsessive ego trip, right? Um, and there I've seen people who can injure themselves or damage themselves in that process. So there is a fine line, and what you're doing is completely acceptable way to be a runner. I'm highlighting this is because I have a lot of people who come and ask that question, or get worried that they're not running as fast, or they're not running as far as some of their other friends and counterparts, and it goes into this self-deprecating mode, saying, "Oh, I'm not as good enough as it." So that needn't be the case, right? So perfectly said. So coming to your own, now you're a faculty in the medical school. Is there a particular subject that you focus on, or is it broadly all kinds of medicine?
Oh, so I'm family medicine, which means
Okay.
I see patients of all ages, newborns on up, multiple generations of the same family. And that's a lot of fun. I really love doing that. And for me, family medicine was really appealing because I like the emphasis on prevention,
Hmm.
that and the understanding that so much of what we see, well, so much of what I see in my practice is lifestyle mediated. And I've just come to that realization over time, really understanding that, and seeing that so much of what I see, the chronic illnesses, stress, anxiety, depression, diabetes, a lot of that can get better. I'm not saying it always cures it, but a lot of that gets better if we attend to some of these fundamentals. How are you moving? What are you
Hmm.
eating? How much sleep are you getting? What is your stress like? And how do you address stress? And a lot of things, we know that things can be improved with that, in addition to medication and other interventions. And so thinking of it as a yes and, it's
Yeah.
not, you know, all it's all lifestyle or it's all medicine, that we really need to be able to bridge that and bring it together. And increasingly, my patients are looking for those interventions beyond medication, right? So they're not necessarily against the medicine, but they want to know, what else can I do? And so it's really fun. As a family physician, I get to see patients over time. So, we can start the conversation knowing that we have the privilege of being able to continue the conversation over time, over visits, over months, in some cases years, about making changes, right? Nothing, you can't fix everything in one visit. So
Right.
being able to see people over time is really helpful and something I enjoy.
Hmm. Hmm. And maybe a slightly a topic that comes to my mind is your view on genetics and this whole thing about epigenetics. Since you see family medicine and you see people for a long time, uh, what are your views on that? What are you hearing, and what are you reading, and what are you researching on epigenetics?
So that's really interesting. So we do know maybe there are some predispositions, but that
Hmm.
even with that, there's so much that we can impact, so much that we can do to modify that course. And so even, and sometimes things that we think of as genetic or maybe cultural, like,
Hmm. Hmm.
is there might be a genetic predisposition to diabetes, but you've also inherited, perhaps your thoughts around food and food preparation and food consumption. And that environmental factor is also at play here, just as one example. And I
Mhm.
think even in cases where, yes, there is a strong genetic predisposition, there are still things we could do to maybe modify the impact of that predisposition so that it's not
Mm.
necessarily inevitable just because grandparents and parents had diabetes that the next generation will automatically develop diabetes. There's
Mm.
still a lot that can be done to mitigate that risk, or even if they do end up developing diabetes, mitigate the impact of it on their life.
Right, right. And so there's this articles that I've read, and it's about South Asians, especially, are prone to these metabolic disorders, like
Mhm.
diabetes, high blood pressure.
Yeah.
So where is that coming from?
So I know there's a lot of work happening in the field, and I think there's, Stanford, for example, has a center on Asian health and
Hmm.
looking at differential risks for various Asian subgroups, not limited to South Asians. And our leaders are literally leaders in their fields about the work being done here and including Asian populations in
Hmm.
research studies and moving beyond assuming what works for one group is going to work for all groups.
Hmm.
I think in our case, as South Asians, the way we carry a fat, adipose, more viscerally, more intra-abdominally, and that's metabolically active. It's not just sitting there and
Hmm.
inert. And that interplay of that increases our risk of developing these diseases, even if we're not necessarily would be classically considered overweight or obese.
Hmm.
So
Hmm.
at a similar body mass index, where our risk for certain things might be higher than someone who's of Caucasian
Hmm.
descent. And
Okay.
so, yeah, we as a group, as South Asians, we do need to be mindful of that. And a lot of my patient population is South Asian, and we have these
Hmm.
conversations all the time. We look at the family tree and we see all these medical problems in the family, and then we say, well, but what are we going to do to, change things for
Hmm.
you?
Hmm.
Because you don't necessarily have to go down that route.
Hmm.
It's not a it's not a inevitable thing.
Right. So I guess what I'm hearing is you can, through lifestyle changes, through proactive action in your the way you eat or you live your life, you can interrupt that process, right? You don't have to fall victim to all what our ancestors did. Um, so I guess running or any form of active lifestyle is in that case more relevant, right? For us as South Asians specifically, right? In the sense that sometimes there is, and I think some of it is changing, but there's also in our culture, in South Asian culture, I'm speaking generally, there is a tendency also to be fearful about activity. Oh, your knees will get injured, or oh, you
Hmm.
shouldn't be doing this beyond a certain age. We have certain cultural baggage, right? So after a certain age, you don't do certain things. You lead a certain lifestyle. You can do certain things when you're young, and just kind of connecting the dots here about running and endurance sports, and this risk to potentially predisposition to metabolic diseases for South Asians. It's just common sense that you should actually take on a lifestyle that's active. So I'm just wanting to highlight that whole point here, um, because
Yeah.
we can just settle that argument forever, right? And hey, there's not even an argument, right? And uh, also the again, I've been a runner, and people keep asking me about concerns around knees. As a runner, most people have concerns about knee, and I have not ever had an issue with knee, and I always have read, and the way I look at it is, as long as you keep your big muscles in your lower body strong, your knees are usually safe. And a lot of people don't do that. And so, in your view, as a medical practitioner, do you see that as well? I mean, is that the right way to look at it, or do you have a different view?
So you bring up some great points, and I think of this in a few different ways. One is maybe up until our grandparents' generation, or maybe or even our parents' generation, activity was part of life, right?
Hmm.
So the built environment necessitated having to walk or having to be more physically active even in day-to-day tasks.
Hmm. Hmm.
You walked to the store, you walked to your friend's house, you were more physically active in terms of household chores. Activity was built in. So
Yeah.
we didn't think of it as exercise per se. We were
Hmm.
just moving throughout our day. And
Right.
then we've sort of shifted our lifestyles to where we now have to intentionally move and be active, and we call it
Hmm.
exercise. And who walks to their friend's house if they don't live next door, or walks to the
Yeah.
store, or does all those things that our parents and grandparents did, and beyond, as just part of their daily activity. And so
Hmm.
we have that factor. Like, we now have to be more intentional about
Right.
getting up and moving, whatever that form of exercise is.
Hmm.
You and I like to run, and I love it, but I understand that when I
Hmm.
talk to my patients, I'm not going to tell them all to go run for an hour every day. They
Right.
don't want to run. They don't like to run. Maybe they don't live in a place where they feel safe running outdoors,
Hmm.
right? And so the idea that we just need to move more,
Yeah.
right? And when in whatever way works for you, is that if it's running, great. If it's cycling, it's great. If it's yoga, it's great. If it's turning on some music and dancing in your house until
Yeah.
you're slightly breathless, great, right?
Hmm.
We just want to build in the movement. And I think because we've shifted from that activity being built into the day to having
Hmm.
to call it exercise and
Yeah.
dedicate time to it, that another thing that I also see is this mentality like, oh, if I can't go to the gym for an hour, I
Hmm.
can't run for an hour, or do this thing, then it's an hour or nothing.
Hmm.
And sort of bringing the conversation back to building in activity throughout your day. So, a lot of my patients work in the tech industry. They're sitting in front of a computer all day, and ask them, can you get up for 2 minutes an hour, or 5 minutes
Hmm.
every couple hours, and get up, stretch, walk around, take that meeting as a walking meeting as opposed to a seated meeting,
Hmm.
right? And just continuously looking for the opportunities and bringing activity into your day. Now, if you go for a run for an hour or cycle for an hour, whatever that is,
Hmm.
also great and
Yeah.
amazing. But in addition, we want to be able to do these other things.
Right. And there's also the element of strength, right? Because I do find that, especially, and again, I'm speaking just for ourselves as a community, South Asians, we get to be less and less muscular as we grow older, and there's a thing about also wanting to consciously lift weights because your muscle mass is reducing as you age, and
Mhm.
you're becoming weaker, right? And so you need to be strong to be able to run. I mean, I keep saying this to a lot of people that normal a lot of times we start running to get fit, but sometimes that whole thing switches over and then you start being fit to keep running. you
Yes.
know so to stay fit to keep running, you need to lift weights, you need to be strong, so your tendons and your muscles can continue support movement, right? Because I see, if you look at, if for example, if you go to the airport, uh, we all travel internationally, and I've seen our older, especially women, South Asian women, they're mostly on wheelchair. And I always say, hey, this is probably a warning for our generation that you got to start building that strength now in your 40s and 50s, so when you're in your 70s and 80s, you're still able to move, right?
Yeah.
Does that make sense?
Yeah, totally. So muscle loss or sarcopenia is a real phenomenon, and not limited to us as South Asians, but we
Yeah.
experience it as well. And so, yeah, so running being, we're using running as an example, but
Yeah.
bringing variety, right?
Hmm.
Just like we talk about eating a variety of fruits and vegetables, or a variety of grains or lentils, a variety of activity, moving the body in different ways, um, is beneficial.
Yeah.
So, even for my really active runners, who are notorious about not wanting to stretch or do anything else
Right.
because they
Right.
so love running. And I appreciate that about them. Bringing it in as what would help your running, what would support
Mm.
the thing that you're really enjoying is
Mm.
devoting a bit of time to weight training
Yeah.
or stretching, and making sure that you remain flexible, right? And so it's also helpful then to think about, well, why do you want to keep running? And for some people,
Mm.
it's I'm running because I like running, and that's,
Hmm.
it's very straightforward. And also for a lot of people, they're running because, or they're active because they want to be healthy. They want to be able to be there for their families or their community or whatever else is important to them. And
Right.
tapping into that as the rationale for, well, part of helping me, keep my why going, why do
Mm.
I do this, would be to branch out a little bit and include a variety of things that support my main activity and help me do it injury free for
Yeah.
longer.
Yeah. Makes sense. All right. I think having said that, maybe it's a good time to pivot into how Ayurveda entered your radar, right? And how do you see that uh, complementing some of these things that we talked about?
Yeah, great. So, as I mentioned earlier, I'm a family physician, and a lot of what I do can be involved with counseling around lifestyle. And while I'm grateful for the medical education that I have and the learning
Mhm.
opportunities I have, I always felt like maybe I could do better in terms of having those conversations with my patients, right? It's more than just eat healthy and
Mhm.
exercise,
Mhm.
right? It's a deeper conversation.
Yeah.
And looking around, reading more about that, still trying to figure out what's the framework in which to have these conversations. And I started exploring integrative medicine. And I
Mm.
attended an integrative medicine conference, and then there was a talk on Ayurveda. And from that
Mm.
first talk, I was like, I'm home. It was really
Mm.
that feeling of like returning to knowledge that had always been there in some format, but like the structure of it, the way Ayurveda thinks about we're all individuals at baseline, we are people who are healthy, right?
Mm.
And understanding, what's impeding that health. How do we remove the barriers to that health? But that the fundamental starting point is health, not
Mhm.
illness. It sort of flips
Mm.
on its head the way we sometimes think about things in the West in terms of health, and health being a comprehensive state of being, right? It's not
Mm.
just that the body is healthy or the lab results look great. It's about the mind being healthy, the body, the digestion, your constitution being healthy. Like all of that works together to make you a healthy person. And even the World Health Organization has adopted some elements of that in their definition of
Mm.
health, and that it's more than the absence of disease.
Mm.
And it really being able to call that out. So, from that first talk, I just read up on my own for a period of time, eventually took a course to become an Ayurvedic wellness counselor, and just really felt like that fit into my practice because it was focused more on the preventive measures.
Mm.
You know,
Mm.
your activity, what is your nutrition like? How do we individualize that? I like to say Ayurveda is the original precision medicine because it
Mm.
was about the individual and not just the disease state. And precision medicine, especially here in the Bay Area, right? Big buzzwords, a lot of work around, that topic, but that
Mm.
there's 5,000 years of wisdom that we're saying, yes, we understand that everyone's an individual who has health as their foundation, and we're here to work with them to uncover their health. So I
Mm.
just found that framework super helpful, logical,
Okay.
and felt like this is something I could bring into my practice. It wasn't it wasn't against what I was trying to accomplish in terms of working with my patients. And I felt like it gave me tools so that, the patients in my office, maybe 30 minutes, and even if I saw someone every day, which I don't, right? Feeling like they could leave the office with something that was useful and actionable for the other 99.99% of their lives that happen outside
Mm.
my clinic. Um, that's really the goal here is, you know, empowerment of the individual and understanding where they are and what can they do next, because
Mhm.
ultimately their health is within them and in their hands.
Makes sense. So, give us an example, right? How does it look in practice? So, like, especially for us here who live in the US, right? And as South Asians, most of us are have heard of Ayurveda, right? I
Sure.
mean, your parents and your grandparents, or things like even Siddha medicine, for example, are things that you are aware of, but we don't necessarily use it in our daily life because we go to doctors here and basically live on prescription medicine if there's a problem, right? Or over the counter, whatever, right? So how does it look like for someone to embrace this in practice? So does it so I so does it, so what I'm trying to get to is, do you, as a Ayurvedic consultant and a medical doctor, suggest certain food types? Do you get into certain lifestyle practices? So talk to us a little bit about that.
Sure, sure. And this is just an example. And I would always
Yeah, yeah,
encourage everyone to, this is not meant to be like individualized medical advice and please talk to
yes.
your doctors about making any changes. But one example is around sleep. And I think about this
Mm,
a lot because I see a lot of people who are complaining of various ailments. And then when you go back, you realize they're not getting nearly enough sleep. But it's not just about how much sleep are you getting, right?
mm,
So if you're getting 8 hours of sleep in 24 hours, but your sleep time is from 4 a.m. to noon,
mm,
you know, if you're a shift worker, that's one thing. But otherwise, that's maybe not the ideal time to sleep. And so, maybe before I'd be like, well, how much sleep are you getting? And someone would say 7 hours. And I'd be like, fine, let's carry on. But then to really drill down on that, okay, what time is bedtime? And in Ayurveda, they would say bedtime should be by 10 o'clock at night. Well,
mm,
why? Between 10 p.m. and 2 a.m. is a period of time for the body where it really works to digest and process everything we've taken in during the day. And that's not just food, right? So we also digest our thoughts, our
mm,
perceptions, what's been going on mentally during the day. We sort of digest, we finish working on those things, process, package, and prepare for the next day. And that happens between 10 and 2 at night. And
mm,
you don't make that up if you go to bed later, right? You
mm.
miss out on that opportunity. So you may be potentially starting the next day still carrying over the leftover baggage, so to speak, of the day before.
Okay.
And, not setting yourself up for feeling refreshed when you wake up or ready to go. And so talking to people about, is it possible to get that bedtime around 10 o'clock and why? And,
Mm,
modern sleep science is backing some of this up. So, but this is something Ayurveda understood thousands of years ago. And now let's
mm,
back it up even further slightly. What's happening in that hour before you go to bed, right? Many of my patients, they're working, they're on, they're finishing up things right until they close the laptop and lie
correct.
down, right? And
Yes.
we understand, Ayurveda talks about routines when you wake up in the morning or, seasonal routines, nighttime routine. And that just like we do for our kids when they're little, we have this whole bedtime routine. We do the bath, we put them on pajamas, we read the story, the whole song and dance, right?
Hmm.
And the importance of that is we're cueing our child's mind to understand this is the time to wind down and relax. Just
Mm,
because we're in bigger bodies doesn't mean we don't also need that,
right.
right? And how that looks or what happens during that time can be different. But to the extent possible, can we get away from the screens?
Mm,
Whether that's your phone, your tablet, your laptop, your television, and use that time to cue your body that it's time to go to sleep and prepare for the next day and having those conversations with patients. So it's really fine
hmm.
tuning and understanding this is what we need in order, if we want to be successful to the day, we have to start the night before and what's happening that night before and
Hmm.
and diving into those conversations. And it's there's logic to it. It's not,
Right.
it's not something that's made up, and we could have a whole argument about what counts as evidence is,
Mm,
tradition and history. How does that factor into evidence versus, research studies that we're used to reading here in the West? But that to the extent that people are able to do that, I've, gotten the feedback that yes, they felt better the next day, they felt more rested, um, mood is better, blood pressure goes down, they
Mm.
just overall feel better, feel less stressed, feel more able to handle the stress. And that starts with getting enough rest, right? If we're
Hmm.
always starting the day behind because we don't ever get enough sleep, then increasingly our ability to handle the stressors that inevitably come goes down. And that could lead to mental stress, physical stress, illness. And, can we deal with something that's maybe considered simple, but so fundamental as making sure you're getting good quality sleep? And if that
Right.
alone does the trick, great, then, we've made a huge impact in someone's life talking to them about their sleep in a way that maybe is different than what they're hearing before.
Yeah. Nice. That makes sense. In fact, now I sleep with my Apple Watch, and I've been measuring my sleep, and just in terms of what's the resting heart rate and how many hours of deep sleep am I getting. And what I found, you're right. At least for me, at a personal level, I'm collecting evidence of what happens that in the day, like for example, having a drink, right,
Mhm.
actually increases my heart rate in the sleep, right. I've seen my heart rate, rested heart rate, is always higher when I've had alcohol, for example. So it was a contrarian learning, because sometimes you learn up you grow up learning that alcohol helps you relax, and but on the contrary, it actually increases my heart rate in the sleep. It reduces my deep sleep.
Yeah.
So uh, you're right. I mean some of these things um, are absolutely make sense, and I wish physicians like you continue to advise that to us, because um, by ourselves we are just happy popping in pills and saying, okay, this is fine, right. uh, the other thing is food. Now I know Ayurveda has categorization of food types and body types. Now, do you also use those in your in how you treat people?
So what I do with food and, Ayurveda, probably the thing people hear most about Ayurveda are the doshas, the
Yeah.
mind body types. And if you're a certain type, eat this. And if you're a certain type, eat that. And but fundamentally, Ayurveda is a very practical science.
Hmm.
So it's not that food is bad. It's just
Hmm.
understand the impact that food might have on you, and that impact can vary based on your stage of life, based on the
Hmm.
time of year, based on whatever else is going on with you as an individual, your personal constitution, your illnesses. So it's a complex interplay, and it acknowledges and celebrates that we're all individuals and we're
Hmm.
complex systems. It's not
Hmm.
so reductionist in terms of how it
Hmm.
approaches
Hmm.
things. So, one example. So, if someone has a lot of trouble with what looks like an excess of fire in their system, and how does that show up? Heartburn,
Hmm.
irritability, red rashes, inflammation, um, then maybe they're not necessarily tying it to what they're eating, but almost inevitably I'll find out there are people who like to eat really spicy foods
Hmm.
or lots of really sour foods. And they don't necessarily make that association. And I'll say, you know, maybe observe how you
Hmm.
feel after you eat these things and consider eating other things that might be a bit more cooling to your system. Bringing in more mint or coriander or something like that,
Hmm.
and just observe that and see what you think. And, if you don't think that's relevant to you, so be it. But maybe you'll notice if you ease off on some of the really spicy foods that some of these things that you've come to me for get better without me having to, you know, throw a lot of creams or pills at you. Now, those
Hmm.
medications may be necessary, and I'm not here
Hmm.
to say
Hmm.
that there's no
Yeah.
role for that,
Right.
um, but that it's a yes and. We can
Hmm.
do the medication, but we could also consider these other factors. And, the beauty of Ayurveda is, really drilling down to that. Would I have necessarily made the correlation between somebody who's complaining of like uh, red, angry rashes and the
Mm.
the chilies that they eat, but now I might say, oh, well, how are you with these things? And
Mhm.
and can we shift that slightly? Can we make some adjustments, and can we observe how you do? Are you open to that? And I find many of my patients are open to that, and at least open to try it and see if it helps. Occasionally patients are like, no, I don't think that has anything to do with it. And that's okay. I'm not here
Mhm.
to force anyone to do anything, whether it's take prescription medicines or, you know, cut down on their chili intake, but I can provide some observations and allow them to use their own intelligence as to what they feel like would resonate
Mhm.
with them or doesn't resonate with them.
Yeah, makes sense. And you made a interesting point about history, and a lot of what we know in Ayurveda is through history and word of mouth. And then there's this whole Western scientific approach to evidence based medicine. Now, I've always been curious about why isn't there clinical trials being done for something like Ayurveda, for example, right? Today Ayurveda medicines are available, right? If you go to India, you get shops, you get pharmacies that are just purely doing Ayurvedic medicine, and people in India, just use Ayurveda as a full time basis for their health. I've always been curious as to why aren't clinical trials being done on specific each of these, or maybe are they being done? But any thoughts on that?
Yeah, they are being done. And there's a lot of work happening in India, the Ministry of Ayush in
Hmm.
India, Ayurveda, Yoga, Unani, Siddha, and homeopathy. I hope I got that right.
Yeah.
Is doing work. There's some work happening here. And, we a couple of years ago, the Center for Asian Health here at Stanford, we put on a multi-day international conference on evidence-based traditional Asian medicine, and half of it was
Mm.
about Ayurveda, half of it was about traditional Chinese medicine. And we
Okay.
had a really great conversation throughout it about what do we consider evidence, right?
Mm.
And so we're used to, when we talk about prescription medications, for example, the double blind placebo controlled trial, which means the patient and the researcher don't know what the patient is getting. There's a group that's getting the medicine, a group that's not getting the medicine, and we're measuring a specific outcome.
Hmm.
And so we give 1,000 people the same medicine or the placebo, looking at their
Hmm.
diabetes. One of the challenges in the traditional systems is, as I said earlier, it's a precision medicine. So the idea of giving 1,000 people the same
Mm.
thing is not part of how we think about Ayurveda or how we think about traditional Chinese medicine. So we
Mm.
think, there's that one challenge. The other challenge that comes up is, these lineages of knowledge have developed like over time, and each lineage has their own version of a particular treatment.
Okay.
So, a popular one that maybe the listeners have heard of is Chyawanprash, right?
Mm.
That jaggery based, has multiple herbals in it, but every group includes different things in it and in different
Mm.
proportions. And so, how do we, come to an agreement? This is the standard formulation, and we're going to test it. And how do we identify which one of the multiple ingredients in it is having the effect? And I know these are things that people far smarter than me in this area of research are working on.
Hmm. Hmm.
We also think about safety, and are things being harvested sustainably? Are they being harvested in accordance to the tradition? So, for example, a certain herb being harvested at a certain time of year has different biomechanics than another time of year. And are we honoring that? And then when we do the study and we say, oh, it didn't work, but
Mm.
did we prepare, do we, harvest, prepare, and use it in the way it was intended to be used?
Okay.
And so it's multifactorial. And like I said, there are people both here and in India, I think, working on it. There are multiple journals publishing this data. And so I know this is something that Ayurveda, traditional Chinese medicine, grapple with. How do we understand really what's happening? A a very basic example is turmeric, right?
Mm-hmm.
Very common in South Asian cooking and other Asian cuisines. And so anti-inflammatory, it might help reduce infections, all these things. And so then it was this idea, we're going to throw turmeric in capsules and you could just take that instead of a pain reliever. And then it didn't work initially when they first started doing that. Well, why? Why didn't it work when it has all this great tradition behind it? The active ingredient in turmeric is potentiated by the active ingredient in black pepper. So if you don't have those two together, you are missing out on the benefit of the turmeric. Well, when we use it in our cooking, almost invariably, turmeric and black pepper are in the same dish, right? And we knew that with like the traditional wisdom is like these things belong together and we use them in our cooking. And when you throw turmeric in a capsule without understanding that interplay, you've missed out on the benefit of it. And then you can also have the whole conversation. Should we be taking turmeric in capsules? Would it be better, or more helpful if we incorporated it in our food, used it in the ways where it was traditionally used?
Yeah, that makes sense. Now, maybe it's a good time to, since we talked about Ayurveda and it being kind of precision medicine, which means that you can't get on a podcast like this and give generic direction to anyone. You will have to consult, and an Ayurvedic practitioner will have to understand your peculiar background and history before they can say, "Hey, here's what you should do to get better or get healthy." But I'm definitely interested to see, because a lot of our listeners are runners and athletes and endurance athletes. Are there any maybe top 3 or 4 Ayurvedic principles that might help performance, like getting faster or getting stronger? What is there anything that you can generally recommend that people can take on as Ayurvedic lifestyle?
Right. Yeah. Great. So I think about running. I'm going to use running as the
Yeah.
example.
Yeah, you're a runner, so that's the best thing to do.
Yeah. And something that's been gaining, more and more research is coming out is zone 2 training, right? Which is you train within a sort of lower range heart rate for the bulk of your activity if you're an endurance athlete, and that it helps, with building up certain types of muscle fibers and mitochondria, the energy storehouses that go up, and all of those benefits accrue, less likely to get injured. Ayurveda talks about training or, activity to 50% of your capacity. Zone 2 is probably between 60 and 70%. So, sort of similar idea. The other thing that I think about, something that's really helped me with Ayurveda, is to sort of reframe how I think about endurance. So we can think about endurance in multiple levels. Endurance for the race, the marathon or the ultra marathon or whatever the race is. It's endurance for the training, right? Because we understand in order to get to the race, you have to have prepared for the race. But also endurance for your life and for your lifespan. So, part of my why is to be as healthy as I can, as long as I can. And so for me, endurance is measured in years and decades. It can also be the endurance of training for a race and the race itself, but that ultimately my goal and my endurance is to be 20 years from now, 30 years from now, still active and healthy and be able to participate in my life and all the things I want to do. And I think Ayurveda also talks about physical activity in that way, that it is one part of what is happening in your entire life. And so maybe encouraging people to think broadly in terms of their why. And, for someone who's like, I like to run because I like to run, that's totally fine. I have no judgment on that.
Right.
And also that it's also okay to say, I run because it helps me keep up with my kids when I play with them after school. That's also a great reason to run or be active. And so I think about it in those things. Ayurveda will, sometimes talk about, depending on your constitution, that maybe being more active or less active is better. So if someone is, um, maybe heavier set, heavier build, they might be able to tolerate more strenuous exercise. They have more reserve than someone who's very light or small framed, and maybe they don't have that same level of endurance. And so maybe modifying or looking at that, based on where you are in terms of your own individual
Hmm.
constitution. But the idea is that we're training for at multiple levels, and I think all of us
Right.
are to more or less extents. But how much do we really think about that as we go through our day to day lives? And then also how you fuel yourself.
Hmm.
If you're heavier constitution, how your nutrition might look a little different than someone who's lighter. But of course, we still want to make sure that we're eating things that are seasonal and to the extent possible fresh and
Hmm.
local, because we know that that is far more nourishing to us than something that's packaged or shipped or been sitting on a shelf for a long period of time. So being really thoughtful about your nutrition choices, and again, just observing the difference when you eat those things
Yeah.
that are fresher and local and in season versus when you don't. You may notice a difference in terms of how you feel, how satisfied you are, what your energy level's like, how you interact with your environment. And that makes a difference in your ability to endure whatever it is your level of endurance is.
Yeah, you just made my day because on the second part, right, about I'm a heavy set guy, and there's a lot like us who are slightly bigger made, and we don't look like those Kenyan, elite runners. We're not skinny and with thin legs. We're like well built, and you just made my day. So yeah, okay, endurance is for me in precision nutrition.
Yes,
Yeah, yeah,
absolutely. Right?
yeah, yeah. I was just, yeah. Uh, Makes a lot of sense. In fact, I was saying that in jest, but I think even on a serious note, for people who are hearing and listening to this, that's a big question, right? For a lot of people who are big made, in the popular culture has made skinny, uh, whatever you want to call it, more acceptable, or an aspirational way to look for everyone. So everyone is out trying to get skinny, but a lot of us are thick. We have big bones, we have big muscles, and it's the way it is. And and you can be an endurance athlete, and
Totally.
you're probably stronger enough to handle that. And I like that because I want to underscore that, because a lot of people uh, have these misconceptions and say, oh, I'm big man, I can't run. I said, no, just you just heard it. You
Yeah.
probably are meant to run or endure, right? And coming to the first point that you made about the 50%, so now we have different. You have the Mafton method that a lot of runners use, which is we do a calculation of your target heart rate that you should be at. You take that call.
Oh, no, no, no. Sorry.
Okay.
It was a pop up on the computer. I
Okay.
apologize.
No worries. So you basically arrive at a target heart rate of, say, your age, 180 minus your age, and you say that's the heart rate that you should be training at.
Hmm.
Anything above that is not necessary, or zone 2 is the other way to do it.
Yeah.
And right, and and now there is enough acceptance among the endurance athletic circles, that there's no point killing your body doing high intensity workout for all the workouts, right? If you're working out for 5 days, 80% of the time has to be in low intensity. And so it looks like the our ancients figured that out a long time
Right.
ago.
Right. That there was this understanding of,
Yeah.
right, a different frame of reference around endurance.
Right.
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 And what what is the strategy? What makes sense physiologically in order for you to have long range endurance? And I don't mean
Right.
like ultra marathon endurance, that too, but
Yeah.
also long range lifespan endurance. Right. And so, runners love to run, and we don't like it when we get injured because then we can't run. Well, what can we do to reduce our risk of injury? And this is a way to do that. And we, you mentioned this earlier about, also engaging in other activities, right? So I see this with a lot of my patients who do run, right? So they will complain of a knee injury. And I think that's where it comes up, oh, running's bad for your knees. But it's not usually the knee that's the problem, right? It's the muscles in the front of the thigh or the core
Mhm.
that are imbalanced or not strengthened. And so being able to look at the person holistically and not just the knees, all right, there may be an issue with
Yep.
the knees we need to address, but can we look upstream and downstream from the knees and see what else is going on? Does someone
Yep.
have flat feet and they need more arch support? Is there a difference in their leg length? And so their strike is different foot to foot. And that's why one leg hurts and the other one doesn't, right? There's so much that goes into it. We
Mhm.
are complex systems, and it's
Mhm.
very tempting to reduce to the one thing, but can we think bigger? And I think Ayurveda and these traditional healing systems thought bigger,
Mhm.
and sort of bringing that conversation back. We need to think bigger, we need to understand
Mhm.
bigger. And I do see that in allopathic medicine coming, right? More
Mhm.
of that, and thinking about things more broadly. And Ayurveda for me gives me a perspective around that to frame that and have those conversations with some logic, some structure, and feeling like the evidence as it's
Yep.
presented in Ayurveda to back up those recommendations.
Yep. Makes sense. I think those are great points, Neeta. I think we did cover quite a bit of ground in terms of lifestyle, the modern medicine, and how kind of Ayurveda entered your radar, and how it can be helpful for a lot of the people who are into fitness. I think there's a lot of intersection, and thank you for what you're doing, because I do wish a lot of um modern medicine, mainstream medical practitioners embrace, alternative, ways of healing and treating, because as public, right, as non-medical consumers, we are reading about it on Google and books and all that, and when you go to a doctor, you're like, why isn't my doctor talking about it, right? It's mainstream. It's not, those days are gone where information is available to everyone, right? And
Right.
so it's as a consumer, as a patient, you always want your doctor to also be reading about it and embracing it, and coming to the conversation with a point of view, right? Otherwise, you kind of wonder what's going on, right? And so thank you for what you're doing, and you being in an institution like Stanford, and adds a lot, that much more credibility in terms of what you guys are doing. So very heartening to hear about this whole integration of modern medicine and ancient medicine.
Yeah. And I
um,
would just say, I don't think my medical colleagues, I think very few of them are resistant to it. I
mhm,
think
mhm.
the volume of information that we're asked to know about is a
Mm,
lot.
yeah.
And it increases every day exponentially. Just from the time I went to medical school and now, the things that have
Mm,
completely changed in terms of what I originally learned and how we do things now, innumerable.
mm,
And um, so when I teach medical students or others about Ayurveda, or traditional medicine or integrative medicine, I say you don't have to necessarily agree with this when I have these conversations, but just be aware it exists, and can you
yeah.
be curious about it?
Yeah.
And maybe not the expectation that everyone's going to know everything about all of these things, but can we be curious to understand, you know, where is the patient coming from when they bring these things up, right? They're trying to
Hmm.
take care of their health. We
Hmm.
can, appreciate that they're trying to do what they can to take care of their health. And we don't always have to have the answers.
Yep.
Is that a good idea? Is that not a good idea? But can we follow up on that? So the follow
Yep.
through. So I get asked questions all the time about a particular supplement or
Hmm.
approach. And if I don't know about that, I'm not familiar with it, I feel okay saying, I'm not familiar with that. Can
Hmm.
I get back to you on that?
Hmm. Hmm.
And, again, because I'm in primary care and I have those ongoing relationships with patients, I have the
Hmm.
privilege of being able to do that. And so, it's about the dialogue. It's an ongoing
Hmm.
dialogue. And, can we at least be curious about where the other one is coming from? And, I would ask that patients, be open if your clinician is like, I'm not sure that's a great idea, and here's why.
Hmm. Hmm.
Please be open to that. And it's not necessarily an automatic dismissal of what you're trying to do, but
Yeah.
that they are coming from a place of genuinely caring about your well-being and expressing their concerns. And so allowing that dialogue to happen in both directions.
Yep. Great. All right. I think coming to the last part of our conversation, I have a fun Q&A round that I ask all my guests. So I wanna, shall we do that?
Great. Let's do it.
Okay. Here we go. So food is always on top of mind, or everybody's mind, especially if you're an endurance athlete, runner. Food is always on top. And my first question that I have for all my guests is, what's your favorite junk food?
Hmm. Dark chocolate? Does that count?
Dark chocolate is health food.
Sorry. That's my favorite thing.
Okay, no, no, I was kidding. But yeah, if that is what is your indulgence, it is what it is, right?
Hmm.
Yeah, but you have a healthy junk food choice, so that's good. Uh, a favorite Ayurvedic approved breakfast.
Oh, let's see. Something warm, like
Hmm.
oats or chia pudding, um,
Okay.
with some nuts and maybe
Ah,
some dried fruit, like dried cranberries.
nice. So why? So why would you call it Ayurvedic approved? Is it because of the warmth, or is it?
Yeah, I think the warmth, it's grounding. So for
Hmm.
me, and so many people, right, we're off running in 10 million directions all day
Hmm.
long. Having something that's warm, grounding, nourishing feels like a
Hmm.
nice start to the day. And it helps
Yeah.
me feel settled and ready to take on whatever's next.
All right. Okay. What's a favorite way to what's a favorite way for you to spend a Sunday or a lazy day if you're not practicing medicine or running?
Oh, probably, time with family,
Hmm.
either we're playing at home, or I have young kids, so
Hmm.
being outdoors with them, or time with friends. um, yeah, just without having to have like certain structure or outcomes to
Yeah.
it. Can we just enjoy the day, go for a
Yeah.
walk, go for a hike, something like
Yeah.
that?
Okay. Uh, you're a song. You're a book or a movie person.
Book.
Book. Any favorite books?
Too many.
Okay. Anything you would like to share that I
Let's see.
recommend?
So I recently read a book called Built to Move.
Hmm.
It's written by a husband and wife couple, and they talk a lot about this idea of functional fitness. So being
Hmm.
able to do certain movements that will help you stay fit throughout your life, so that when you're in your 70s and 80s, you can still do things like sit down on the ground and get up, or other things like that. And I think that fits in with that idea of endurance over a lifetime.
Yeah. Yeah. I should check that book out. And my last question, which I ask all my guests, is if we made a movie of, I know you said you're not a movie person, but let me ask you this anyway. Um,
Oh gosh. Okay.
if we, or maybe we made a movie of your life, um, what kind of genre would you put it in? And who would you hire to play your role?
Oh my gosh. So yeah, I'd want it to be something light and fun.
Uh-huh.
So I don't know. I don't know who I would ask to play me. I can pick anybody.
Yeah.
Um, all right. The first name that popped into my mind was Priyanka Chopra.
Oh, okay. Okay.
I'm not claiming I look anything like her at all, but I think she's awesome. So her.
That's great. That doesn't matter. It doesn't matter how she looks, if she resembles you or not. She's an actor. She's got to play you.
There we go. We'll take
There you go. So Priyanka, I'm sending you a script. Get ready to play a, Ayurvedic medical doctor.
Oh gosh, I'm sure she's busy.
All right. Hey, thank you for that. We learned a few more things in the process about you. We're coming to a wrap up here. I want to give you the last word. Any final message in the show that you want to share with our listeners?
Oh, before I do, briefly, Santosh, thank you so much for the opportunity to talk to you. I've really enjoyed this, and I love the podcast. I would say just remember health is part of who you are, right? You are fundamentally healthy. And, if it seems like too much, just pick one thing to try different and see how you feel and take it from there. And, you can set your goals and they can be your goals. Don't worry about comparing yourself to what other people are doing, because we're all on our own journeys. And what you're doing is just as valid and just as amazing as what anybody else is doing.
Awesome. All right, Neeta, thank you a lot. Thanks a lot again for sharing your wisdom, your journey, your experiences, and your expertise here. I'll let you go and enjoy the rest of the afternoon. We'll stay in touch, and you have a great day.
Sounds great. Thank you, Santosh.
Bye.
Take care.